Hello, my name is Dr. Prem Patel, and I'm an internal medicine resident at The Ohio State University Medical Center.
Hello, my name is Sebastian Kelle. I'm a board-certified cardiologist and leading the cardiac imaging unit at the Deutsches Herzzentrum der Charité in Berlin, Germany.
And I'm pleased to be joined by Dr. Kelle today, who will be discussing the results of his trial, Check, mobile CMR to improve subclinical heart failure detection in rural areas. Dr. Kelle, thank you for joining us today.
Thank you so much for inviting me, because I think we have to think new about our healthcare system and what we can provide to our patients in the future. Heart failure is a growing pandemic, and we have to see how can we reach the patients and can provide very early diagnostic and treatment recommendations. We conducted a large trial where we scanned 4,500 patients within 2 years using 2 mobile CMR trucks within rural areas. We detected early diastolic dysfunction in these patients, included also lab sample testing and quality of life assessment. And we got surprisingly high numbers of affected patients. And this implies for the future already implications. How can we treat these patients and where's the demand?
Very interesting. And with the increasing inequities when thinking about cardiovascular care in rural communities, lack of advanced imaging modalities, how do you see the effects of Check being implemented in the real world and any potential policy issues that might stand in the way of that?
Yeah, if you read the recent paper from the American Heart Failure Association and see the map of the US, for example, then look up the Midwest and the South. So you see increasing numbers of patients with risk factors like diabetes, obesity, and arterial hypertension, and you see increasing death rates in these areas. And these areas are comparable to rural areas, also industrial countries like Germany and in Asia and Australia. So it's a worldwide phenomenon. So we think that this might be an idea to provide telemedical supervised heart failure screening worldwide.
Very interesting. And with the routine use of echocardiography as a first-line imaging modality within cardiology, how would you think that the mobile CMR compares to that, and what issues might you foresee with using echocardiography rather than CMR in this case?
So CMR requires very often experienced staff. This is something you can provide from a centralized lab, for example. And so that doesn't have to be the expert reader on the truck itself. It can be run just by a technician. However, it's more expensive than echo, and echo is cheaper and much more wider available. However, we have the human factor. You need someone who is doing the echo. This person has to be experienced, and especially when we talk about the population at risk, obesity is one factor which limits actually the accuracy of the echo scans. And therefore CMR might be something as a quantitative tool which can provide data, also which patient will suffer or which patient will benefit most from next treatment recommendations. And therefore, based on the trial we just conducted, we are working on a risk factor calculator. And this calculator can be used, for example, in the future to better characterize patients at risk who then undergo an extensive echocardiography, for example.
Very interesting, Dr. Kelle. Thank you very much for sharing. For more videos like this, please check out our YouTube channel at youtube.com/FITsOnTheGo. Thank you for your time.